Hi, I'm here today with psychiatrist Dr. Chris Burke with Psychiatric Services. Would you be able to tell me a little bit about the practice?
Yeah, we are a comprehensive psychiatric practice. It was started by Joel King. He sort of constructed this group to really provide a specialized group of providers who really treat work-related injuries. There's two board-certified psychiatrists and four nurse practitioners, and we're currently present at two locations, one in Lower Manhattan and the other one out in Long Island in Smithtown.
So, what is the population of patients that you treat?
Well, as I mentioned, most of the patients that we see are referred to us through workers' comp or no fault. Of course, we do see some private patients, but most of the patients are people who were hurt on the job. And they range from construction workers to law enforcement, firefighters, transit workers, even first responders. Usually there's some event that took place that they were injured on the job. And it's impacted the quality of their life. What we've seen actually is that most people who cannot return to work, this affects them in multiple ways. First, a lot of people identify themselves by their job, and they feel that they're kind of lost without a sense of purpose when they can't go back to work. And second, most of the patients we see are living paycheck to paycheck. A lot of them are married with children, and when they're not able to work, this puts tremendous strain on their relationship. They often feel guilty and they get depressed. We see also a lot of patients with back and head injuries, who've gone through multiple surgeries and have a lot of chronic medical pains.
So, it sounds like most of the people you see have physical injuries. Specifically, how does psychiatry figure into this?
Well, I'm a board certified consultation liaison psychiatrist. That's a subspecialty of psychiatrists that really focus on the medically ill. Throughout my years of providing psychiatric consultations, I've done it to just about every service, which includes cardiology, oncology, orthopedics, pain management. And I've worked at two major medical centers. And usually patients, they're admitted for a physical reason, and we are providing psychiatric consults to them on the service. In general, these are patients with medical health issues who present with symptoms that are actually best managed by a psychiatrist. And usually as a consequence of their injuries, depending on the acuity, whether it's a back pain or head trauma, some traumatic event occurred that cause significant psychiatric symptoms. And these often go undetected by the patient, the family, and even the providers.
So, what types of psychiatric illness do you see?
We see patients with anxiety, depression, memory problems, PTSD. We kind of see the whole gamut of them.
And how do these patients generally present to you?
Well, obviously, each patient is unique. Their presentation is really sort of specific to the nature of the injury or the event that took place. However, what is notable is that most of these are patients that have never seen a psychiatrist before. They often go undiagnosed, but they can present as being sad or tearful, with terrible anxiety, sleep problems, and depression. Another group that actually we see quite a fair amount is patients with head injuries. Patients, when they've hit their head, they can present with any number of neurological symptoms that often will not show up on a scan, but that doesn't mean that these patients aren't suffering. They can present as not being able to tolerate loud noises or bright lights. They can be jumpy. They have poor balance. Sometimes they have really bad headaches and other neurological problems. This group often takes a long time to get referred to us. They have terrible physical symptoms, and these tend to be overshadowed. This will overshadow their psychiatric symptoms.
I get the feeling that people are reluctant to see a psychiatrist or be on medication. Why do you think that is?
Well, look, pain causes stress, and this leads to changes in their neurosystem, including chemical changes in the brain. And these are changes that really weren't present there before the injury. They present as irritable or anxious with memory loss or depression, And it's been shown that if you treat the psychiatric illness, that the medical illness gets better. One of my hopes in speaking to you today is that to kind of reach out to the reluctant patient and simply provide a better understanding of the treatment that is available to them.